People traveling outside of Canada are being urged to take extra precautions as monkeypox continues to be an issue. The Public Health Agency of Canada notes that the virus, typically only found in West and Central Africa, has cropped up around the world, with cases in Canada, the United Kingdom, Spain, and more than 24 other countries. They say it spreads mainly through close contact with the virus on other humans or objects, such as bed linens. While it can be fatal, it is most often not. Well, joining us now to give us his advice on staying safe while traveling in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to be here.
So the government has issued a level 2 travel notice, urging travelers to take extra precautions while traveling. What do you think about this, Dr. Raut? Is this the right move right now?
Right. So we have 4 levels of travel health advisory. Level 1 really just reminds travelers to practice travel health precautions in their destinations, such as hand washing. Level 2, which is where we are with monkeypox, is an increased risk to travelers or certain groups of travelers, and reminds them to practice enhanced health precautions, sometimes personal protective equipment, and avoiding high-risk activities. Level 3 is basically avoiding non-essential travel, and level 4 is avoiding all travel whatsoever. So based on where we are with monkeypox, I think level 2 advisory is reasonable at this time.
So how risky is traveling at this time amid monkeypox and COVID-19?
Right. I mean, that's a very good point. Monkeypox is not an easily transmitted disease like COVID-19, and it does require prolonged contact with an infected person or even material for transmission. But the important thing is, as long as Canadians are taking these extra precautions while traveling, we don't really expect this to get too much worse.
So what kind of extra precautions should Canadians take while traveling?
Right. So the long and the short of it really is looking at washing your hands and wearing a mask. They're very good precautions for traveling. There are also very specific precautions, avoiding close contact with sick people, including those with skin lesions, avoiding contact with dead or live wild animals, especially small mammals such as rodents, rats, or squirrels, avoiding eating or preparing meat such as from wild game, and avoiding contact with contaminated materials used by sick people, such as clothing, bedding, or other materials in healthcare settings.
Now, it's interesting that we mentioned last week that it can spread from human to human, but it can also spread through beddings and clothing items. So should Canadian travelers consider packing their own bedding and washing them themselves?
I think that's a very good concern. We know that contact with objects or fabrics, including bedding, could be a possible source of infection for monkeypox. But as long as the beddings have been washed, we don't expect any significant concerns. So we have to just keep that in mind as well. If we're going to a place where we're not sure if the bedding is washed routinely, then it is better to pack your own beddings.
And what about water, Dr. Raut? We know some viruses can survive in water, so should Canadians avoid going in pools during their vacations?
Right. So there's always a risk with swimming pool illnesses. We see the diarrhea, gastrointestinal. We see a lot of respiratory issues, ear and skin infections from multiple organisms. We haven't heard too much about monkeypox in swimming or pools in general. If you're going to be swimming with multiple people abroad, keep in mind that there are, in fact, a host of different illnesses you could pick up. So, common sense, don't drink the water and take a shower before and after the pool.
And are there any other countries that Canadian travelers should avoid at this time? We know the UK has one of the biggest outbreaks outside of Africa, so should people avoid the UK?
So that's interesting. We now have about 28 different countries with travel advisories there, going all the way from Argentina, Australia to Mexico, Netherlands, the UK, United States, and UAE. I think what we're going to see is that list is going to increase, and it's going to be very similar to the level 2 that we have with COVID, which is all countries have a level 2 advisory.
All right, Dr. Raut, just in case you were to be infected, what sorts of medications and preparations should travelers consider in case they start displaying symptoms while traveling?
All right, so at this time, there are no specific treatments available for a monkeypox infection, but we know they can be controlled. We have good evidence that the smallpox vaccine is at least 85% effective in preventing monkeypox, and most countries will now look at giving that vaccine to people who they suspect have monkeypox to make it less severe.
All right, Dr. Raut, a lot of great advice there. Thank you again for joining us today on Forum Daily for our weekly medical segment. We'll see you again next week, Dr. Raut.
Thanks so much for having me.